Now, back here in the United States, more than 46 million. Rarely does a day go by in the debate over health care where we do not talk about the number of uninsured Americans. But who are they? Bloomberg's Lizzie O'Leary takes a look and has some answers.
Marcus Grimes is 38. He loves poetry, playwriting, and basketball. He's also blind. Blind from a degenerative eye condition that his doctor could have treated if he'd had health insurance.
Fix it. I asked, is it fixable? And he says, yeah, we could repair it. And he said, but because you don't have insurance, you're going to need $3,000 down minimum, before we can do anything. Yeah.
Grimes was earning $43,000 teaching high school English. $3,000 out of pocket was far too much. So was $500 a month to buy into the school's health plan.
Because I had a pre-existing condition of diabetes, I couldn't afford the health care premiums.
7 years later, all he sees are gray halos.
I miss it. I miss my students, my kids.
Here's how Marcus Grimes' case was typical. Most of the uninsured, roughly 70%, work.
Often they work for small employers, or they work in the types of industries like service jobs that are just a lot less likely to offer health care.
And they don't make much money. Nearly 2/3 have incomes 1 or 2 times the poverty level, but they make too much money for Medicaid. A disproportionate number are young, between 19 and 29, without the money to pay for health care. They're relatively healthy, and they could be attractive to insurers if a federal subsidy gives them purchasing power.
And so there will be some new customers for private insurers, many of whom will be getting subsidies since right now they can't afford the coverage.
That could add up to more than 30 million new customers overall, according to the Congressional Budget Office. One reason analysts say insurers have embraced reform. Lizzie O'Leary, Bloomberg News, Washington.